Hello, it's Jan again. I would like to take just a couple of minutes to let you know about a new phase that I think will also be important in patient safety. We are developing a concept called OurNotes. We have long thought that having records that are held and generated by both clinicians and patients could contribute to patient engagement and possibly patient safety also. So that's the patient side of it. We also think that there might be opportunities to save clinicians time. We are just developing this idea. I'm going to go through this fairly quickly. We started out by interviewing experts around the country about how to get started on this idea, basically. And if you are interested in the details, they are in a paper. Mafi is the first author in the Annals of Internal Medicine from last year. I urge you to look at it. The bottom line was that experts advised us that the most important step to starting in the idea of co-generated records would be by doing something before the visit. And we have come up with a plan, which we are about to pilot, which I want to describe to you. About a week before a visit, a scheduled visit, a patient would get a note saying, you have a visit coming up. We would like for you to give us some information before you come in. And so the patient is getting this invitation at home. And what we want them to tell us is, number one, how have they been doing since the last visit? How are their symptoms? How is their health? Has anything important happened? And number two, what do they want to talk about in this visit? What are their top priorities? So one reason we're sending this to them a week before the visit is to give them time to think about these two things. They think about it, and then they write to us. They write back. And the way it will work is that once they get into the appointment, what they have written will show up in their note. When the doctor opens the record, what they have written will be there. And so this doctor says, I see you've been walking 30 minutes a day, but you're having trouble sleeping. And the patient says, that's right. So this, we think, will save time in the visit. And then when the visit is over and the note is generated, what the patient wrote will be part of the note. That is the idea in a nutshell. We are about to start pilots of this idea in these 4 sites, and 3 of them are Epic sites. We have our own homegrown EMR, so this will be in at least 2 different EMRs. It'll be fairly small, but we should know something about how it's going in about a year, because we will be talking with both the doctors and the patients. We want to know some of the obvious questions. Will patients do this? It's sort of like when we first started OpenNotes. Will patients look at the notes? We didn't know, and we don't know how interested patients will be here, but we'll find out. And if they do it, will the clinicians find the information useful? What do the clinicians think about the impact on their workflow? We really hope it saves time, but we'll see. And finally, do both of them want this idea to continue? We really believe that this addition to OpenNotes, this co-generation, may have some additive value in patient safety, both parties being more prepared for the visit, the patient having time to think through things, and there may even be some impact on really how the clinician processes information. You hear about something in an interview with a patient. Maybe they will think about it differently if it's in writing. Well, we don't know. All of these things are TBD.